The World Health Organization recently issued a report that frighteningly stated that by 2030, which is just 5 years away, there'll be a paucity of 10 million healthcare providers globally.
Wow.
And that, yeah, it's huge. And that about 50% of them, at least in one point in their career, suffer from burnout. So,
Wow.
yeah, we really need to make some changes in the healthcare system.
Sonia, there's an NHS 10-year plan. Can you just talk us through what's in the plan? And I'm interested in your thoughts as to whether it goes far enough.
Yeah, I think in principle, the kind of tenets of the plan, which feel very visionary, are around sort of moving care from the hospital back into the community.
Yep.
They're about is supporting prevention, moving from treatment to prevention, and then
Yep.
also, being digital by default. So it has its critics, and there's a lot of pros and cons in there, but the main kind of tenets that underpin it, I think, resonate with most of us as healthcare providers.
Yeah, as they do with myself. And just for those of you that are tuning in right now, my name is Greg Martin, and I'm talking to Sonia Neary. She's the chief executive of Wellola. Sonia, can you just dig into those three things a little bit and give us a little bit more detail around each of them?
Yeah, for sure. So I suppose from the hospital to community it's fairly obvious, that kind of a lot of people when they come to the hospital setting, they come because they're acutely unwell, but oftentimes they find themselves in a hospital bed a lot longer than is necessary. If we can give the patient enough information, enough of the tools to understand their condition, what to do, when to escalate, when it's
Hmm.
appropriate to come to your primary care physician or your A&E and so on, that's the starting point.
Yeah.
The next kind of support layer obviously is friends and family and those next of kin that support. And then we're moving into primary care, allied health. So there's lots of models that we're seeing around hospital at home, virtual wards, digital care pathways, where patients are kind of given those tools to manage in the comfort of their own home. And I think there's a big shift in thinking, particularly since COVID, that model is much more acceptable in how we deliver care.
Yeah, absolutely. So let's treat people in the community as much as possible. But then the next aspect to all of this is let's try and prevent people from getting sick at all. So shift from treating sick people to preventing sickness in the first place. Can you talk us through that a little bit?
Yeah, 100%. And again, I think it is still that kind of shift in supported self-management,
Mhm.
distributed kind of responsibilities around the care model. It's not a kind of a passive engagement where something is done to the patient by an external care provider. It needs to be more and more the patient taking ownership, their families taking ownership, the care providers in the primary care facilities and in the community. So what can we do at a population health level to
Yeah.
support people? Is it in schools? Is it in colleges? Is it in workplaces to teach them about how to, better care for themselves?
There is a positive aspect of the private sector being involved in health, and that is digital, right? We're seeing real
Mm.
solutions coming from the private sector that are making a difference. And this is why I'm interested in the third tier of that NHS plan, which is digital by default. And you're the chief executive of a healthcare digital company. Could you talk us through digital by default and in particular how Wellola is positioning itself in the context of this NHS plan?
Yeah, 100%. So again, digital isn't for everybody. We do need to recognize there are multiple needs in the market. Citizens, some of them will have to present in an analog fashion, but the majority, that are willing and able, that have access, and that's another question, I suppose, to a digital device, can be cared for in some ways digitally. So, the kind of NHS app being at the center, as the main sort of digital front door, and then all of this really exciting suite of technology that sits around that feeds into the hospital electronic patient record systems and potentially the health information exchanges. It's all about giving the right people data, be
Mhm.
it, from a symptom tracker that the patient tracks, from a wearable or medical device, from clinical assessments. Within our system, we've got something called virtual care pathways. So you can build out digital programs for service users, whether they've got a chronic or acute condition, a mental health or a physical health condition, so that they're guided through educational resources and tracking their symptoms. And it's bi-directional, so that only when, they really sort of stratify for risk at a very high level do they then need to come in person for care.
Exciting stuff. And if people want to, where can they find out more about Wellola?
Sure. So we're at wellola.com. I'm Sonia Neary. Please feel free to reach out to me on LinkedIn or via the web. So thank you.
Listen, thanks for your time, Sonia. It's been absolutely lovely talking to you. Take care.
Thank you.